Hi, I'm Malachy Clancy, assistant professor in the Department of Occupational Therapy at Thomas Jefferson University. And on behalf of my co-author, Robert Dekerlegand from the Department of Physical Therapy, also Thomas Jefferson University, I'm excited to share key findings from our recent study, Optimizing Long COVID Outcomes in Interdisciplinary Survey of U.S. Rehabilitation Providers. Long COVID continues to be a major challenge in rehabilitation, and we set out to explore how well rehab providers understand the symptoms of the condition and whether clinicians are aware of and using evidence-based resources to improve patient outcomes. The results revealed some concerning gaps, but also some opportunities for improvement. We're going to dive in and take a closer look. Long COVID affects millions of people worldwide, yet it remains poorly understood. Some individuals experience symptoms such as persistent fatigue, breathlessness, cognitive impairments, while others struggle with cardiovascular issues, autonomic dysfunction, or post-exertional malaise. As rehabilitation professionals, we play a crucial role in helping these individuals regain function and quality of life. But there's a problem. There's no single standardized treatment, and awareness of best practices is inconsistent. And so that's why we conducted this study, to examine how well occupational therapists, physical therapists, and speech-language pathologists understand long COVID and whether they are integrating evidence-based guidelines into their clinical practice. To get a clear picture, we conducted a nationwide survey utilizing a cross-sectional design through postal-based mailings. To do that, we identified the state with the highest prevalence of adults ever experiencing long COVID in each of the 9 primary divisions of the U.S. Census Bureau. From each of those 9 states, we randomly selected 300 rehabilitation providers, so 100 OTs, 100 PTs, and 100 speech-language pathologists, for a total of 2,700 potential participants. Participants were given a 4-part survey and answered questions about things such as their background and clinical experiences, their awareness of long COVID symptoms, awareness of standardized outcome measures, and red flags or triggers that may or exacerbate symptoms, their use or lack of use of evidence-based resources, and their beliefs regarding the current and future impact on long COVID on rehabilitation practice. So the goal was fairly simple, trying to look for and identify gaps in knowledge and practice that could be limiting effective rehabilitation for long COVID patients. Here's what we found. Some of the numbers may surprise you. About 70% of rehab providers said they were familiar with long COVID symptoms, but differences were noted between each respective discipline in commonly identified symptoms. Only 12.7% knew about relevant clinical practice guidelines, or CPGs, and even fewer, just about 7.4%, were actually using clinical practice guidelines in their practice. While nearly 40% of our respondents reported a general awareness of symptom triggers, only 8.3% knew of relevant screening tools to assess them. One of the most significant gaps that we identified was the recognition of post-exertional malaise, or PEM, a symptom that can severely impact rehabilitation outcomes. While PEM is a major issue for many long COVID patients, 42.6% of the providers that we surveyed were completely unaware of it. Interestingly, physical therapists were more likely to recognize PEM compared to occupational therapists and speech-language pathologists. This highlights the need for interdisciplinary collaboration. Treating long COVID in silos will only lead to inconsistent care. Our findings point to 3 major areas for improvement. First, more education and training is needed on long COVID and its rehabilitation needs. Second, we need better adoption of clinical practice guidelines to ensure evidence-based care. And third, we need greater interdisciplinary collaboration to prevent gaps in patient management. The reality is that many providers think that they understand long COVID, but when it comes to using standardized guidelines and best practices, there's a disconnect. Addressing this is critical if we want to optimize outcomes for patients. As a researcher and rehabilitation professional, I believe we have an opportunity and a responsibility to do better. If you're a clinician, I encourage you to explore the latest clinical guidelines and integrate them into your practice. If you work in a healthcare setting, think about how you can improve interdisciplinary communication so that patients can receive comprehensive care. Thanks for watching. Let's continue to advance the science of long COVID rehabilitation because our patients deserve the best care possible.